Another problem with learning ECG is that ECG is often taught in a very complex manner, and every time the student comes across ECG class, they start with a level which is much beyond his league. So ECG becomes so difficult for him that he says, okay, let's leave it. We are going to call a specialist, a cardiologist or something, and get it over with. And he is never confident when he is working in an emergency situation, because he already has got deep down in his heart this knowledge that he doesn't know anything about ECG. So I've decided to make advanced ECG in such a simplified manner that it's easier to understand, easier to interpret, and it's much easier to then move on and help the patient save lives. So the objective is to understand the basic concepts of ECG, ECG paper and components of ECG in a very simplified manner. Following that, the basic process of signal movement in the heart, and how does it affect the ECG waves and ECG segments, and how to understand, measure and interpret an ECG. And finally, to recognize basic arrhythmias, their interpretations, and then move on to advanced knowledge about complex ECGs. And soon one becomes so confident that he looks at ECG and he knows what to do and how to proceed further. So there will be 4 modules, 10 lectures. Quiz test will be there, and all the ECG modules, they are studied with quiz tests and drills and exercises in a very interactive manner. Our slogan is to understand, practice and save lives. So in the first module, we will be discussing the basics of ECG, ECG paper, ECG electrode, ECG signals, and the names of the different waves and segments and whatever is going on. Then a few words about the cardiac vectors, the 12-lead ECG, the rhythm strip, and then finally we will understand that which part of the lead acts as a camera to which part of the heart. So we know which is the inferior part, which lead is looking at the septum, which lead is looking at the high lateral and lower lateral of the heart. So one can very easily decipher and interpret what's going on with the ECG. And we will start from very basics: sinus node, AV node, how is the current progression in the heart going on, and what is the result of that progression on the ECG strip. Finally, we will move on to rate calculations, rhythm analysis, access of the heart, myocardial infarction, the most dreaded part of the ECG interpretation, hypertrophies, interventricular blocks, and some miscellaneous parts. Rate will be done in a very simple manner, and we will go across the different ways of how to calculate the heart rate, and then one can select the simplest and the easiest one which he chooses. Then we will move on to different axes of the heart, finally to narrow QRS tachycardias, and we will discuss the basic algorithms to interpret the different forms of tachycardia. And after that, we will be able to land somewhere, and soon we will be so comfortable that seeing an ECG will be a piece of cake. And we will be able to pick up the scenario which is potentially fatal and which has to be reacted in a very prompt manner. Then we will discuss few of the ventricle pacings and miscellaneous ECGs which are not regular, but we do see them in our practice. Then the ST segments, and trust me, if you understand the ST segments properly, deciphering a myocardial infarction becomes very easy. It's a mathematical process, and once you are through it in a logical manner, you will understand and you will interpret in a very systematic order that which part of the heart is involved and what is the gravity of the situation. You won't be sorry, you will be safe. So when we go to the module 3, we will be discussing the supraventricular tachycardias, and a bit complex part of the ECG will be discussed. But with the basic background which you had already learned, it will be very easy to understand this difficult part of the ECG interpretation. And you will quickly, in a wink of an eye, you will be able to identify the potentially life-threatening situations. So It may get a bit messy initially, but soon you will be safe and you will be comfortable and you will be knowing all the tricks of ECG. And we will help you in an interactive manner with different sorts of illustrations, different sorts of clips, and you will become wiser and wiser in the matter of ECG. So soon you will be skilled enough to restart a heart. So what are you waiting for? Let's get started.